Hello, dear student. Welcome in this topic anti-malarial agent, part 1. So, in this part, we'll see first one, what is malaria? Malaria is a chronic disease, chronic communicable disease, which is to be caused by the Plasmodium species, Plasmodium falciparum. There are 4 species of Plasmodium which are causing the malaria: Plasmodium falciparum, Plasmodium ovale, Plasmodium malariae, all these 4 species. Now, as far as the mode of transmission of this malaria is concerned, it to be transmitted through the bite of the female Anopheles mosquito. And the symptoms of malaria, such as chill followed by the fever, anemia, enlargement of the liver, body pain and sweating, these are the symptoms of this malaria. Now, next we are moving toward the causative agent life cycle of the causative agent life cycle of the malaria. It will be divided into 2 parts. That is the half life cycle that is occur in a human body called as stage in human, and the half life cycle is completed into the body of mosquito called as stage in mosquito. So it will start with the first bite of the mosquito. The cycle will start with the first bite of the mosquito. The mosquito saliva of mosquito will have the sporozoites that is enter into the blood circulation, and these sporozoites through the blood circulation migrate to the liver, and these sporozoites mature to the schizones into the liver. And the schizones further convert into merozoites, and merozoites will release from the liver and will enter again into the erythrocytes or RBC. So till this entering to the RBC, from entry of the causative agent into the blood, into the body, to entry into the RBC is called as a pre-erythrocytic stage. And after entering into the RBC, what are the stages occur, the changes are called as erythrocytic stage. So till this, that is pre-erythrocytic stage. We'll enter into the erythrocytes and will mature or will disturb further. It will get multiply. Merozoites will reproduce sexually, and they are going to be rupture the RBCs or destroy the RBCs and will come out. And few of them merozoites will enter into the gametes or will mature into the form of gametes. Okay, and these gametes cannot be fused into the body of host. Now these gametes, when enter into the body of mosquito due to the bite of the or second time bite of the mosquito, so these gametes will enter into the body of mosquito, into the gut of mosquito, where which they have a suitable environment for their fusion, and after the fusion of these gametes will form oocytes into the body of mosquito. So from this stage, after the formation of gametes and the gametes enter into the mosquito, the life cycle stages in the mosquito will be started. Okay, so the oocytes is one of the stage in the body of mosquito. Oocytes further mature and will rupture the oocyst. Oocytes mature to oocyst. Actually, this sac-like structure which called as oocyst, when oocyst ruptures, will releases the number of sporozoites. Now sporozoites will now available into the salivary secretion of the mosquito. When mosquito will bite to the human or to the healthy individual, through the salivary secretion will enter into the blood circulation. So in such a way, the cycle is going to be repeated. Half life cycle completed into the body of human, half is completed into the body of host. Okay, so this is the stages of life cycle of the Plasmodium. Next, as far as the classification of these anti-malarial agents are concerned, the agents which are used in the treatment of malaria are called as anti-malarial agents. And that first is the sporozoanticides, which will kill the sporozoites. Sporozoite stage can be killed. These drugs effective on the sporozoites. Pyrimethamine is one of the example. Tissue schizonticides, which will kill the schizons into the tissue. Example is a primaquine and proguanil. These are the example. Blood schizonticides, which will kill the schizons into the blood circulation. So that depends on the fast-acting schizonticides. We have example quinine, chloroquine, amodiaquine, and slow-acting schizonticides. We have example proguanil and pyrimethamine. Then gameticides include the example primaquine and quinine. These are the examples. So this is a classification depending on the site of action, whether they are acting on the sporozoites, schizons, or schizonticides or gametes. That depends. Now next, the second basis of classification of this antimalarial agent, that is the chemical basis of classification. And that first, the quinoline derivative, which has a quinoline heterocycle in their structure. So alkaloid, for example, is a quinine is one of the example which has an antimalarial activity, which is an alkaloid. Next, 4-aminoquinolines, chloroquine, amodiaquine, these are the example. 8-aminoquinoline derivative, example primaquine, all are quinoline derivative, maybe 4-amino or 8-amino. Next, acridine, which has acridine, 9-amino acridine derivative, mepacridine, it is an example. Bigonides, which has a bigonide nucleus in its structure, proguanil, it is an example. pyrimidine containing or diamino-pyrimidine containing, pyrimethamine and trimethoprim. These are the examples. Miscellaneous class include the sulfonamides, protonsil and the sulfones. Dapsone. Dapsone is also used as antileprotic, and this can be used in the treatment of malaria also. Next, first drug we are going to deal which are acting as an anti-malarial, that is quinine. So it's an alkaloid which is present in the cinchona bark, Cinchona calycia, Cinchona saccharirubra, Cinchona officinale. These are all the sources of cinchona bark from which the active chemical constituent that is the quinine. Quinine is obtained from cinchona bark. Next, it contains the quinoline heterocycle. Definitely, physical property include white to light yellow color, odorless, very bitter taste, crystalline powder, and very slightly soluble in water. So these all are the physical properties of this quinoline. As far as the chemical property is concerned, it produces the blue color fluorescence with the dilute H2SO4. It produces blue fluorescence when it is diluted with or treated with or its solution prepared with the dilute H2SO4. Same identification test in our practical syllabus. We have to perform exactly quinine sulfate dissolved in H2SO4, and we have to see the fluorescence under the UV light, because whatever the fluorescence is there which we have to see, so we have to expose the solution into the UV light or UV rays, so that there is a occurrence of the fluorescence, and that is the blue shade fluorescence, and one of the identification tests for the quinine and quinine sulfate. Next, stability storage condition. It should be stored in tightly closed light resistance container. Blood uses as a blood schizonticides which kill the schizonts, and also used as a gametocides also. Next, it is used in the treatment of severe and complicated malaria caused by falciparum. It is used in the treatment of the cerebral malaria. Now, to relieve the nocturnal night cramps or leg cramps, to relieve the muscle cramps in particularly the myotonia congenita, which is actually the prolonged muscle contraction, and the slow relaxation, myotonia congenita. So in the treatment of these also as a muscle relaxant, this quinine is useful one. Now, formulations of these quinine include quinine sulfate. Mostly it occurs as a sulfate bisulfate salt. So quinine sulfate tablet is available. Quinine bisulfate tablet is available. Quinine hydrochloride salt again, because it is an alkaline drug, will form the salt with acidic drugs. So quinine hydrochloride tablet, quinine dihydrochloride injection. So these all are the preparations or the formulations of these quinine sulfate. Brand name includes the Malaria mixture, which is a popular brand, then Flufo and Vigotap. These all are the brands for the quinoline. Next drug that we are going to deal, that is chloroquine. So chloroquine, instead of directly going to the chemical name, we'll see first the structure of this chloroquine. So chloroquine, it is actually a quinoline derivative. You can see that this is a quinoline heterocycle present, and on the 4 position the amino and the side chain, that's why this quinoline is called as 4-amino quinoline derivative. Chloroquine is actually the 4-amino quinoline derivative. Okay, so as far as the chemical structure is concerned, we will take a parent nucleus as a quinoline. We will give the numbering as per the rule. So this is a numbering pattern for the quinoline. So you can see that there are 2 types of substituent present on the quinoline or a parent nucleus. First one, that is simple, which is chloro on the 7th position, and on the 4th position this is a complicated substituent. If there is a complicated substituent, we'll give the separate numbering to the complicated substituent. And as per the rule, we will give the numbering to this complicated substituent, which is a long chain. So we have to start the numbering from this carbon, which is directly attached to the parent nucleus. So we'll count it as 1, then it's a 2, 3, 4 carbon chain. On 4 carbon chain, it may be a butyl. Okay, and if it is 4 carbon chain called as butyl, on the butyl first position there is a methyl, and on 4th position there is a NN diethyl. NN diethyl, or we are calling on 4th position diethyl amino. Okay, it's a diethyl amino on 4th position, and on 1st position there is a methyl. So if you are going to write the complicated substituent, name of complicated substituent in a bracket, so that will be the 4, that is 4 diethyl amino, then 1 methyl, butyl amino. So this is a complete name of the complicated substituent which is attached on the 4th position. So this 4 out of the bracket 4 indicate the position of the quinoline, that is this 4th position, and this 4 indicate the inside the bracket, which is the part of the complicated substituent, which is a part of the butyl. Okay, so this 4 is inside the bracket, name of the complicated numbering in the complicated substituent, and outside the bracket 4, this is the position of the parent nucleus, that is of the quinoline. Okay. Now 7-chloro is a simple substituent. So alphabetically 7-chloro first, then we'll write 4, this 4 in the bracket, we'll write completely this 4 diethyl amino 1-methyl butyl amino. So this will be the complicated substituent, and quinoline at the end we are writing the name of the parent skeletal structure, quinoline. So next, this is all about the chemical name, structure and chemical name of the chloroquine. Chloroquine is the most preferable drug in the treatment of malaria, used as a treatment as well as for the prophylaxis of the malaria. Next, as far as the physical properties are concerned, it is a white odorless bitter crystalline powder freely soluble in water. Next, the chemical properties include when it is treated with the picric acid solution, the crystals of picrate having melting point 207 degrees Celsius are obtained. Next, when its solution in the nitric acid is warmed with ammonium molybdate solution, the yellow precipitate is obtained. This is a second chemical property of this chloroquine. Next, stability storage, it should be stored in tightly closed light resistance container. Next, as far as the uses of this chloroquine is concerned, it is used to suppress and cure the malaria. As I told that it's a most preferable choice for the drug for the treatment and the prevention of or precaution or prophylaxis of the malaria. So it suppresses and cure the malaria. Next, it is used in the treatment of amoebic hepatitis as an antiprotozoal agent, because this malarial parasite again, Plasmodium, it is again a protozoa. So basically that is protozoa. So antiprotozoal agent again can be used, or as well as the chloroquine can be used effective against or show its effect against the Plasmodium. It means it can be effective against the other protozoa also, like amoebic dysentery, amoebic hepatitis, a protozoal infection, Entamoeba histolytica. So this will be effective on the Entamoeba also, because that is again a protozoa, and Plasmodium again a protozoa. So next, it is used in the treatment of giardiasis, Giardia lamblia, dysentery due to Giardia lamblia. It is used in the treatment of chronic discoids and the systemic lupus erythematosus. So systemic lupus erythematosus, it's actually autoimmune disorder. It's an inflammatory disease caused when the immune system attack its own tissues or own cells. So particularly on the skin cells, it is being attacking, these antibodies are produced and attacking on the skin cell, will damage the skin cell, results into the systemic lupus erythematosus. Okay, so this is an autoimmune disorder. In this treatment, in the treatment of autoimmune disorder also, this chloroquine is effective one. Next, to treat the rheumatoid arthritis due to anti-inflammatory properties, chloroquine has an anti-inflammatory property. That's why it can be used in the treatment of rheumatoid arthritis. Pharmaceutical formulation includes the chloroquine phosphate tablet, chloroquine phosphate injection. So mostly this chloroquine is available in the form of salt form, that is phosphate salt form. That's why chloroquine phosphate tablet, chloroquine phosphate injection, chloroquine sulfate again a salt form. So chloroquine sulfate tablet and chloroquine sulfate injection. These are all the pharmaceutical formulations of the given drug chloroquine. Now as far as the brand names are concerned, it is available in the brands such as cisplaquine, Amobiotic and Nivaquine. Nivaquine, you can see that chloroquine phosphate containing. The brand names are Ciplaquine, then Amobiotic and Nivaquine. These are all the brands for this given drug chloroquine. So this is all about the antimalarial drugs. In this part we had seen two drugs, quinine and the chloroquine. Both are quinoline derivatives. So in the next part we will see the remaining drugs which are belonging to the antimalarial agents, or which are categorized as antimalarial agents. Remaining drugs we'll see in the next part. Thank you so much. Thanks for watching.